Good afternoon. County Executive Rich Fitzgerald here with Dr. Deborah Bogan from the Allegheny County Health Department to give our now weekly update on the coronavirus pandemic. As we have seen over the last 3 to 4 weeks, the numbers continue to go up. The number of positive cases that we've seen tested positive, the percent positivity, and Dr. Bogan will give those results during her briefing. We also starting to see hospitalizations as well as fatalities start to rise as well. And the question is, and the concern is among those 25% or so of our population who are unvaccinated, in addition to the children under the age of 12 who are not eligible for the vaccination. So we are really urging very strongly, if you are unvaccinated, first of all, get vaccinated. That's the best way to protect yourself and your family. But if you are out in public, coming in contact with people, we really strongly recommend you wear your mask. This COVID variant, the Delta variant, is much more contagious and spreading much more quickly. We're seeing it in other places of the country that are in much worse condition than we are, particularly places in Florida and Texas, Louisiana, where their hospital systems are literally being overrun. So we really want to make sure that we're protecting particularly our young people who don't have a chance under the age of 12 to be vaccinated. The other thing that we saw last time is in many ways, if you were young and got the COVID-19, it wasn't always so serious. This one's different. The Delta variant is much more virulent as well as contagious. So for the unvaccinated, they are really, really at risk. So anyway, let me turn it over to Dr. Bogan to give her weekly update, and then we'll be taking the questions coming in from the media. Dr. Bogan?
Good afternoon, and welcome back to our, again, weekly COVID-19 briefing. I wish I had good news to report today. Sadly, I don't. Daily cases are up, hospitalizations are up, positivity rate is up, all discouraging trends, especially as we approach school openings and vaccine not yet available to those younger than 12. Here at the Health Department, we continue to seek the best ways to communicate about the pandemic to the public. We aim to reach everyone, but in particular, we really want to reach the approximately 25 to 30% of adults, mostly younger adults, who remain hesitant to get vaccinated. Many have strongly held beliefs and fears, often as a result of misinformation that is spread on the internet and among friends, colleagues, and families. This misinformation really worries me, and frankly, it keeps me up at night, but I'm not giving up hope. I believe we can and we must do better. So what do the numbers look like? Over the past week, our daily average has nearly doubled to about 150 new confirmed and probable cases. And with a high of 227 new cases on Monday alone, the average is only going to get higher. The positivity rate, which hovered around 1% for much of June and into early July, is now nearly 5%. Hospitalizations are also up, although fortunately not as high as they are in regions of the country with lower vaccination rates than we have here in Allegheny County. As we know, the Delta variant, combined with the still significant number of unvaccinated people, is driving our trends. And it's now having an impact on children here too. In the county, we have had an increase in the number of cases among children. In all of July, there were 25 children ages 0 to 4 years diagnosed with COVID, and in just the first third of August, that number is 67. Similarly, there were 85 children ages 5 to 12 diagnosed with COVID in the month of July, and so far in August, there are already 121. As cases rise among children, so will hospitalizations. Dr. Williams from Children's Hospital of Pittsburgh reported yesterday that they are seeing a small increase in pediatric hospitalizations in the last couple of weeks. And as I mentioned last week, many people, especially parents of school-aged children, have reached out to the health department voicing their opinions on masking in schools, with some urging me to issue a mask mandate at schools and others urging strongly against any masking policies at all. My position remains unchanged. I strongly urge schools to follow the CDC recommendations on masking. To remind you all, the CDC currently recommends universal masking for all students, staff, teachers, and visitors to K-12 schools, regardless of vaccination status. The CDC recommendations will help reduce the spread of COVID-19 and keep our children safe as they return to school. Children under the age of 12 cannot yet be vaccinated. If we put them in schools without safety measures in place, we risk significant spread within the schools. So again, I can't say it strongly enough. All schools should follow the CDC recommendations to safely open. I'll end with two reminders, the ones that I've repeated many times. First, masks that are worn properly greatly reduce the spread of the virus. They are very effective. You only need to look at hospital data. Spread of COVID within hospitals where masks are universally worn is extremely rare. So please follow the CDC guidance and wear a well-fitting mask when you are inside with others and can't physically distance. Second, the vaccines work. They're extremely safe and effective. Although we're seeing an increase in breakthrough cases around the country, most people who get seriously ill or die are unvaccinated. The more cases we have, the more variants that will emerge, and we simply can't predict how the next variant will behave and who it will impact. So please go get vaccinated. Even if you're in the age group that is unlikely to be seriously affected, get vaccinated for the elderly and the immunocompromised who are at higher risk from the variant. Get vaccinated for all the children who still cannot be vaccinated and protected. Get vaccinated for yourselves, for the peace of mind it brings knowing that you are protecting others by protecting yourself. If you have any questions about the vaccines or getting vaccinated, please call 211. They are willing and able to help you. I thank you for your time. Please be safe and be kind.
Our first question today is from Pittsburgh Magazine. As certain businesses begin to once again require masks, even for the vaccinated amid the rise of variants like Delta and Lambda, can we expect a countywide masking mandate to be reinstated anytime soon?
Well, certainly we're in a much different place than we were as we began summer in early June and even through mid to late July. At that point, I think, that the case numbers were very low and the numbers were looking very good. As things change, you do see that our universities, our healthcare facilities, our various businesses are starting to look at mask mandates for their businesses. They're looking at vaccination mandates for their employees and business customers, et cetera. So at this point, everything's on the table. We certainly will continue to look at where we are, and we're in a different place than we were just a week ago or even 2 weeks ago. So consulting with Dr. Bogan and her team, we'll certainly continue to evaluate that. We see that Philadelphia today is making an announcement along those lines. We see that California is also making announcements along those lines, and you're starting to see a trend that's heading in that direction as these numbers become very serious, seriously high. And Dr. Bogan, enumerated that in both the numbers, the percent positivity, et cetera. So we want to make sure that people are safe. We instituted a requirement of our own employees just 2 days ago. It went into effect on Monday regarding our employees, new hires, as well as existing hires, existing employees who are unvaccinated with constant testing as well as masking. And I think you're going to see more and more of that as time goes on, particularly if the numbers continue in the wrong direction.
This next question is from WESA. Many parents take the stance that it's not a big deal if their child gets COVID because the disease is generally mild in kids. As a pediatrician, do you agree with this perspective?
No, I really don't, and here's why. We really don't know the long-term effects of the virus on children and their long-term health. Second, I really like the report that's put out weekly by the American Academy of Pediatrics and the Children's Hospital Association. They put out a weekly report on COVID and children. And from the most recent report, among states reporting to that state-level data on children, 0.1 to 1.9% of all child COVID cases result in hospitalizations. Again, that's a wide range. So you take the middle, it's 1% of cases among children are hospitalized. Among states reporting, again, to that report, they report 0 to 0.03% of all child COVID-19 cases resulted in death. Those are, they're low numbers, but as case numbers increase, you're going to see more children. It's proportionate. So you're going to see more children hospitalized and unfortunately small, tiny numbers, but children will die from this infection. And the other thing is we don't really know, we know that children like adults with comorbid health conditions or coexisting conditions are more likely to get serious COVID, but really we don't have a way to predict who's going to get serious illness or mild illness. And so if it's your child who gets seriously ill, that's really scary. And so that's another reason. And the other reason is that we have MIS-C, which is the multiple inflammatory syndrome of childhood. Again, that's a late effect of the virus, and we don't know who gets it, and it results even from very mild illness. And finally, children spread the infection to other people. So for that reason, I really don't think it's a great idea to let children just get infection because they have mild illness.
This next question is also from WESA. What should people do if they lose their vaccination cards?
So if you got the vaccines from the health department or any of our clinics, you can call 211 and they will help you. If you got it from another vaccine provider and you know who that is, you can call them. And if you aren't sure, you can try your healthcare provider who can look into the Pennsylvania State Immunization Information System, we all call that SIS, and find the results of when you got your vaccines and provide you that information.
This next series of questions is from KDKA. Why are children seemingly becoming targets of the virus? What is the county's reaction to these numbers with school starting soon, and what measures should be taken to address this?
So I think I answered the first one already in that we are not entirely sure if the Delta variant causes more severe illness in children or not, but it does appear, as more children get the virus and get sick, proportionately, a proportion of them will get hospitalized. So I think that's really what we're seeing. They've been trying to figure out the severity, whether there's worse illness in children with Delta. Again, I would say that's not entirely clear at this point. But to prevent infection and spread in children, people have to wear masks. Especially among children who can't get vaccinated yet. So we need to protect children by following the CDC guidance, wearing masks. That's what I would tell people. Wear properly fitting masks. I walk around all day and see masks not worn properly. They're just not effective if they're not worn properly. So I'm going to say it again, properly worn masks using the CDC guidance.
This next question is from the Pittsburgh Business Times. There's obviously more concern about the Delta variant and also where this latest wave will take us. And as you mentioned, we've seen Philadelphia County and others impose a mask mandate. What metrics would it take for that and other mitigation measures here in Allegheny County? Can you talk a little bit about what your decision process would be and where the data is leading you?
I don't think there's any one data point that we can point to say if cases go above a certain point or hospitalizations go above a certain point or the percentage positivity hits a certain threshold. I think it'll be a lot of different factors kind of coming together and taking a look at where things are spreading, where there could be some hot spots, that type of thing. So there's no one metric that we can say, if we hit this on Thursday, that, on Friday there's going to be, some sort of mandate in place. I think the bigger concern is to, watch where these trends continue to go. And as we said earlier, where we were right around Memorial Day in early June, as these cases were in single digits, and the vaccination rate was extremely high, and has slowed down. We know 3 out of 4 people, roughly, adult population, have been vaccinated at least with 1 shot, most with 2 shots. But we've really got to continue that movement in that direction. And I see these efforts that are out there by companies, by organizations, by churches, by on and on, about all the folks trying to encourage their neighbors, their friends, their coworkers to become vaccinated. That's the answer. Certainly we've got to be concerned with masks and our kids that are under the age of 12 who don't have the ability to get the vaccine just yet. We hope that occurs very quickly as well, that approval will come about, from the feds. So we're hopeful of all these things, but we're just going to have to see how the numbers go and where the trends go. And again, the health department will be working with our friends at the state, following CDC guidelines, and those guidelines may change as time goes on.
And this final question is from Print. Why doesn't the county add a checkbox to COVID-19 test forms here that ask whether the person being tested is fully vaccinated?
So that's a great question. Don't forget, people get tested for COVID-19 all over the county in pharmacies and all doctor's offices in different places. What I can tell you is that we use, which I reported last week, we use Curative Inc. to do some of our community testing. And when you register for a test with Curative, they do ask about your vaccination status, and I reported on that last week. It is not universally done, but I will say that the state is working on merging vaccine data with case data, which will allow us to really get at that information. I don't know when that is going to be available, but again, we are gathering that information in the samples that we collect for our county.
And that was the final question, if there are any closing remarks.
Again, we wish we had better news. Dr. Bogan certainly does, and all of us do. But we've seen a rough week when it comes to the test results and the positivity as the Delta variant is spreading throughout the country, and certainly we're not immune to that here in Allegheny County. I note a couple things. The question about the vaccine card, you know, you've got to protect that vaccine card and have it available almost like your driver's license. So I think you're going to see more businesses and more places where you're going to have to show that vaccine card. The other option is to take a picture of it, keep it on your phone. So you have it in two places. You have it on your phone, and then you have it in your wherever you keep your driver's license, in your wallet, whatever it might be. And secondly, we're seeing the school districts. And again, we want to really recommend following the CDC guidelines. About half of the school districts in Allegheny County are instituting mask mandates for the students in their buildings, particularly those under the age of 12 that aren't protected yet by a vaccine. I think the other half are still considering that, and we would strongly recommend that those school districts, again, protect your children, follow the CDC guidelines, and particularly as this variant is spreading, we've got a couple weeks to go before schools start to really open up towards the end of the month. We want to make sure that our kids are protected. Proud of the fact that, you know, most people have really followed the advice to get vaccinated in this region, and we want to continue that and get that last quarter of our population vaccinated so we can get protected and we can, again, feel as comfortable as we did a couple months ago when those numbers were really, really low and the gatherings were strong again. So anyway, stay safe this week. Continue to follow the advice. Continue to stay tuned on where things go, and we'll be with you again next week. Thank you.
Our next regularly scheduled briefing is Wednesday, August 18th at 4 p.m. Thank you for joining us.